Please welcome Dr. Robert Hampshire, Principal Deputy Assistant Secretary for Research and Technology and Chief Science Officer at the U.S. Department of Transportation, and Dr. Shima Hamidi, Bloomberg Assistant Professor of American Health at the Johns Hopkins Bloomberg School of Public Health, in conversation with David Zipper, Senior Fellow, MIT Mobility Initiative and contributing writer, Vox.
Good afternoon. It's great to be with all of you here today, and we're here to talk about what I would consider to be an objective failure in American public health, the U.S. road safety crisis. And I say objective because you can just look at the data. Over 40,000 Americans die in crashes every year, and on a per capita level, Americans are several times more likely to die in a crash than people living in really any other rich country. In Europe, in Asia, we're actually 2.5 times more likely to die in a crash than Canadians, which is a similarly, of course, spacious and car-oriented country. So we're going to discuss a little bit about what some of the reasons for that are and perhaps some solutions. And I'm joined here by Shima Hamidi, who is the Bloomberg Assistant Professor of American Health from Johns Hopkins Public School of Public Health, and Robert Hampshire, the Principal Deputy Assistant Secretary for Research and Technology and Chief Science Officer at USDOT. So Shima, why don't we start with you and focus on road safety to begin. I think that there's an assumption that a lot of road engineers have had for a very long time that wider lanes are safer because there's more room for maneuver if a driver goes a little bit too far to the left or right. And you've done a major project concluding that that's not the case. Can you tell us why?
Yeah, so traffic crashes or traffic fatalities are the #1 leading cause of deaths for people age 1 to 54. US is the #1 in terms of fatalities from crashes, by far 10 times more than any other developed countries. And so a big part of that is coming with street design, the way we are designing our street network. This phenomenon, that wider lanes are safer, most often you end up with streets that are too wide, too encouraging for drivers to drive fast, and no sidewalk, no bike lane, not really opportunities for other modes of transportation. We did test this phenomenon in a national study covering 7 cities, 1,100 streets, and we found that that is not the case. Wider streets are actually more dangerous. They have higher number of crashes, higher number of fatal crashes. So this study has been getting attention. We're working, we got connections with more than 24 cities, 5 states who are interested in working with us to make streets in their cities narrower, from California to Virginia to Maryland, cities all over from Florida. And this is an example of how we can work together with community, with government, to make streets safer, more environmental friendly, and mitigate climate change impacts while providing options.
Yeah, it is getting attention. I saw on, at least on social media, I don't know if you can still use the word tweet, but I saw a tweet about the study that got like 1,500 likes, so it's really making the rounds. Just a question. If you have narrower lanes, whose lives are largely being saved? Is it pedestrians? Is it cyclists? Is it people inside cars? Who benefits most?
Great question, David. So again, we have decades of practicing safety standards that prioritize drivers. And the narrower lanes prioritize pedestrians, cyclists, the most vulnerable users of streets, arguing that if a street is safer for them, then it's safer for everyone. So narrowing lanes will make streets safer, more welcoming for pedestrians, for cyclists, and for drivers as a result. And I want to mention that we also see a huge disparities in different neighborhoods. African Americans are 237% more likely to be killed in a car accident as a pedestrian. And it's because of the lack of infrastructure, safety infrastructure, wider lanes in those neighborhoods. So another part of that is to prioritizing the most vulnerable, marginalized groups of population when you think about street infrastructure and safety.
Thank you. Robert, you do a lot of work with technology and a lot of work about the connection between technology and safety. I know you've done a particular initiative around what's known as V2X, car and infrastructure communications. Maybe you can explain briefly what that is and why you believe that that's an opportunity to save lives.
Yeah, thanks for that question, David. And really, I'm here to invite this public health community to engage with the transportation, with the Department of Transportation. We've done that. We're partnering with Johns Hopkins School of Public Health in engineering to do transportation work and really seeing particularly the safety and climate impacts as really a public health issue. And part of that approach to safety, and we'll get to the answer, is that we put forward something called the National Roadway Safety Strategy. And it's an all-in approach. You need safer drivers. That's behavior. You need safer roads. You need safer vehicles. And you got to get post-crash care correctly. Many people, I think it's around 30% of those who go on to die in a car crash were actually alive when EMT arrived. And so when we think about safety and we talk V2X and connectivity, it really is, we lead with safety. And when you have vehicles that are connected, when you have EMT and ambulances that know what's around them, and can they get through traffic lights quicker? Can they get to the hospital emergency room quicker through traffic? And something called vehicle everything communication or vehicle-to-vehicle communication can help facilitate that. So that's a use case of safety with V2X, and there's many others at intersections for pedestrians, for people with bicycling, and those driving a car.
Mm-hmm. Yeah, and I know your office has done some work around AI and transportation as well, looking at safety impacts there. But if I could, I might ask just sort of like a friendly, skeptical question based on an anecdote of my own experience. I was in Helsinki, Finland, a few years ago, which has seen a sharp decline in road deaths, like 80% plus over the last 10 years or so, 20 years, I should say. And they went a full year without any pedestrian or cyclist deaths at all. So I asked the head of city planning in Helsinki, what role has technology played with cars and infrastructure in saving lives in your city? He said, none whatsoever. We simply slowed down the cars. So I guess we've been living for 25 years in this period of technological Eden, with so much happening in the US around innovation with cars and with infrastructure that's connected. Is it possible it's all a distraction and we just need to focus on the basics to actually save lives?
Great question. The answer is yes, it can be a distraction if done incorrectly. But Secretary Buttigieg really put forward innovation principles that really, we're doing technology, not for technology's sake. At the Department of Transportation, we're focused on safety. And so for AI, for example, we're using AI to help re-engineer the streets so that possibly traffic will be slower, intersections will be safer for those walking, but it really is technology and the purpose of a mission. In this case, that's definitely safety.
That's all the time we have. Please join me with thanking Shima and Robert, and we'll be around afterwards with questions.